Good morning, everyone. Bob Ravenscroft here for this week's COVID update. At midnight, we had 513 patients here at Bryan, and thankfully the COVID numbers continue to decrease. Right now, we have, as you can see up there, 27 patients in here that are COVID related. 20 of them are currently positive. The remaining 7 are still hospitalized, but they are no longer infectious. As you can see, the intensive care unit where the illest patients are, we are down to 5 patients there, and 4 of them are on ventilators, and you can see what's in the progressive care units and general care units. By county, of those 27 patients, dang near a 50-50 split. 15 are Lancaster County and 17 are from outside of Lancaster County. So geez, it wasn't too long ago where that map was lit up with counties across Nebraska, Iowa, South Dakota, a little bit, and Kansas. So good stuff going on out there. Want to announce something. We are going to have an upcoming series that will begin on the 23rd of February, where Dr. Kevin Richmuth will be answering questions and giving a presentation. It's primarily targeted to the general public. Members of the media, you're more than happy to hop on to them. So the first one will begin, as I said, with Dr. Richmuth on the 23rd of February, followed up on another one by Dr. Robert Purcell on the 2nd of March. The one on March 9th with Dr. Patera will be delivered exclusively in Spanish. And then rounding it out, Dr. Bocamper on the 16th of March will be answering things related to the vaccine and women in childbearing years. All of these are going to be translated into 5 different languages and distributed through, influencers in the community, cultural centers, faith-based communities, you name it. So members of the public that are tuning in, it's going to be your chance to ask questions directly to the physicians. And then if you're interested in how you can get this information and maybe share it with organizations you're involved with, we're all ears on that. So there will be a lot of promotion on that. I just wanted to make sure the media understood they are very welcome to hop onto those, but they are targeted at the general public and will be pretty in-depth education all about the safety, efficacy, and common questions around the vaccine targeted at these different audiences. Real quickly, there's been a couple of inquiries that continue to come in on different variants of COVID-19. As of yesterday, Nebraska is one of 8 states, and this was as of yesterday's report. I don't know if it's changed. One of 8 states that has yet to report any new strains. There are really robust studies going on, at all levels on what the transmittability and how virulent these new strains are. As shared in the past with Dr. Nora, the mutations are very common. We are finding them because researchers and scientists are looking for them, which is good. And also announced this morning that I know the country is going to increase its sequencing to 25,000 sequencing tests a week. I want to make clear, Bryan does not do any of the sequencing. So really these questions on the sequencing of the variants in Nebraska are really better targeted to the health department. So anyway, people ask, we don't do the sequencing, but we do send lab samples to the state lab for sequencing. Let's see. Then the last thing, vaccination clinics. As you all know in the media, there are clinics both today and tomorrow at Pinnacle Bank Arena. Our employees continue to volunteer down there, continues to be uplifting and rewarding for them. And then this Saturday, we will again host a clinic here at Bryan, scheduled to vaccinate 1,000 people. Again, we don't really even know who these patients are. The Lincoln-Lancaster County Health Department is coordinating the contacting of these individuals to receive a vaccination. At this time, there aren't further clinics beyond this Saturday for us to conduct at Bryan, but it is a pleasure and an honor to help in any way we can. So just kind of preempting any questions on clinics there. Again, we're helping with the ones at PBA. We'll be doing one here Saturday for patients identified by the health department. Certainly, our hair's not on fire like it was last fall. And by those numbers, it has provided great relief to everybody who works here at Bryan, that they are not in that such intense environment. And we're getting back to normal. You can see from the census numbers, we remain very busy, more routine work. Change in mood and atmosphere, I would say overall, Brent, it's been pretty uplifting, and it's a combination of things. It's one, as the community has helped really knock down and blunt the spread of this, it's brought relief. And I don't know, you kind of felt like you were fighting this by yourself and no one understood it when things were going out of control. So it's reassuring to the staff that the community has responded. And I think it's also combined, as everyone knows, employees at Bryan were able to begin getting vaccinated in December. And in some cases, it was always a very safe work environment because of the mandatory double masking that everyone was not double masking, wearing double mask, but universal masking, combined with such a large number of our medical staff and our employees getting vaccinated. It's a very safe work environment. So I think you definitely feel that here. And it's a relief that we know that we won't be taking it home and helping our family, or not helping, but transmitting it to our families. So overall, yes, it's been uplifting. All along, we are guarding against a potential other surge. Again, the variants are out there. We don't know what's going to happen there. It is certainly not eradicated from the community. So it's a cautionary relief that's being experienced here with preparations to accommodate a surge if it occurs. But thanks for that question. In general, yes, there has been some burden that has been eased, and the mood and atmosphere is certainly not filled with the anxiety that I think you could probably see in all of our faces and hear in our voices back in November. So thanks for asking.